Part 1, describing the study. Why is this study being done? The Health Research Board is funding research which examines the experience of patients who have had a stroke recently. We wish to understand how best to plan and organise stroke services to meet the individual needs of people who have a stroke. We're interested in the whole patient journey from the moment the stroke symptoms started until a person gets home again. In this particular study, we're especially interested in the early or acute phase of stroke. By speaking with people who've recently had a stroke, we might see patterns in their stories that could help us identify areas for improvement in care and services. We want to make every patient's stroke journey better and reduce any potential after effects that a person might have after a stroke. Your experiences are very valuable to us, and we believe that hearing your story will help us to improve care for other people who have a stroke in future. Who is organising and funding this study? The study has been organised by a team of researchers who work at Beaumont Hospital and at the Royal College of Surgeons in Ireland. The study is funded by a grant from the Health Research Board and is part of a postgraduate qualification or PhD for a doctor who works in stroke care in Ireland. Why am I being asked to take part? We're asking you to consider taking part because you have recent experience of having a stroke, and so we feel we can learn from your experience. We believe that understanding your individual stroke journey can help us improve how stroke care is organised for everyone who has a stroke in future. While you weren't well enough to participate when you first came to hospital, your treating consultant feels that you're now medically improved, and we feel that offering you the opportunity to participate is appropriate and in the spirit of fairness. Your family member has already responded to the survey on your behalf, but now that your medical team note that you're medically improved, we would like to hear from you directly. You can fill in the survey yourself, or you can read the answers provided by your relative if you wish, and then give deferred consent to include the answers already provided by your family member if you feel they accurately represent your experience. You're under no obligation to participate. How will the study be carried out? People like yourself who have been admitted to Beaumont Hospital with a stroke will be made aware of the research study by a doctor on their clinical team. And if you're interested in learning more about the study, then a member of the research team will explain the study to you in detail. There are 2 parts to the research. Firstly, everyone who participates is asked to complete a survey with the researcher while you're in the hospital. And if a patient is not able to participate directly, then a family member is asked to consider taking part on their behalf, as happened for you. The second part is 3 months later, where some people, though not everyone, who participated in the survey will be invited to take part in an interview about their experience. About 1 in every 5 people who complete the survey will later be invited for an interview. Interviews will last about 40 to 60 minutes. They will be held at a place of residence of the participant at that time, or online if they prefer. In your case, your family member has already provided answers to the survey to the best of their knowledge. And now that you're able to respond for yourself, we would like to ask you if you wish to participate directly yourself, and if so, to complete the survey with the researcher. Initially, you'll be given time to think about if you're interested in participating in a survey that contains questions related to your stroke. We'll also ask if you would consider being contacted again about 3 months after your stroke to discuss if you would like to participate in a follow-up interview about your experience at the time of your stroke and your experience afterwards. The researcher will return usually the next day after you've had time to think about it and to read this information leaflet, and then they will answer any questions that you may have about the study. You will be asked again if you consent to be contacted again 3 months after your stroke, and your preferred means of contact, for example, telephone or email. You're under no obligation to participate in any research study, and participating in the survey puts you under no obligation to take part in a later interview, should you be invited to do so. Your answers to the survey will be added to the research data, while the previous answers from your family member will be removed. If, however, there's gaps in your recollection of events at the time of your stroke that responses from your family member can shed light on, then they can be added with your permission. If you prefer that only your own responses contribute to the study, then all responses of your family member will be removed from the study data. What will happen to me if I agree to take part? If you agree to participate, you'll be asked to sign a consent form to give your permission to participate in the survey. If you prefer to use the answers from your relative, then you will be asked to sign a deferred consent form to allow the researcher to use the data collected when you are unwell. If you prefer to complete the survey yourself, then the researcher will go through each of the questions of the survey with you one by one. The survey will have questions about stroke in general, but also about what happened to you personally from the moment you noticed stroke-like symptoms, your experience of getting help, of getting to the hospital, and your treatment. The researcher will fill in the answers with you on a secure tablet device, and you can check that the responses reflect your experience accurately. The survey will take about 20 to 30 minutes and will be filled in at a time that suits you and will not interrupt your time with your multidisciplinary team members. Your care will always be the priority. The researcher will already have reviewed your medical records on the ward to collect information about your stroke, including the type of stroke, your blood pressure, blood sugar readings at the time of your stroke, and your medical history. You'll not be asked to give any blood samples or have any new tests. If you attended Beaumont by ambulance, we will ask the Dublin Fire Brigade or the National Ambulance Service to summarise the times that they recorded for all calls related to your stroke. You can stop participating in the research at any time. For example, you may experience tiredness and need to rest or be called away for therapy or a test. The discussion while completing the survey will not be recorded in video or audio format. If recalling or describing the details of your stroke causes you any distress or upset, you can tell the researcher you wish to stop answering the survey questions at any time. You can stop for a break temporarily, or you can withdraw from the study altogether. This will not impact your medical care, and your distress will be acknowledged and supported. What are the benefits? While you may not benefit directly, it is hoped that the results of the study will help people who have a stroke in future to have the fastest possible access to the care that they need. We want to improve how stroke services are planned and organised to make them as fast and efficient as possible for everyone, so that people have the best possible outcome after their stroke. What are the risks? The study involves a survey with questions about your experience of stroke, about your understanding of stroke in general, stroke care and stroke services. We'll ask what happened around the time when you first noticed the symptoms of stroke. For some people, this might be distressing to recall. If you experience any distress during or after discussing the questions on the survey, you can speak about this to your research team or to your medical team. Additionally, the Irish Heart Foundation or IHF have a stroke support group who can be contacted by telephone on 016685001 Monday to Friday 9 to 1, and they can also be contacted by email using the address support@irishheart.ie. Confidentiality is important in research studies, and we will have a number of safeguards in place to ensure that all of our conversations are confidential. In a hospital, this can be a challenge, but all the files and paperwork for the study will be confidential, and every effort will be made to make sure that confidentiality is maintained at all times, while also giving everyone who wishes to participate the opportunity to do so. So what if something goes wrong when I'm taking part in the study? It's very unlikely that anything will go wrong as a result of participating in this study. However, if you feel distress as a result of the survey, you can speak to the researcher or to your stroke team. The last page of this form has contact details of the research team, whom you can contact for advice or support. Is the study confidential? All information collected will remain confidential at all times. Your personal details like your name, age and address, and contact details, telephone number and email address will be coded so that only the research team will be able to determine your identity. We will let your GP know if you participate, unless you prefer that your GP is not made aware. If, however, your answers to the survey questions indicate that you're very distressed, then your medical team will be told so that they can support you appropriately. Your medical records will remain in the possession of Beaumont Hospital at all times and never removed from the hospital for this study. You have the right to access all information gathered with regard to your contribution to the study, and we hope to publish the results of the study in scientific journals. However, you will not be identifiable in any publication, and we will anonymously acknowledge your help in the study in future publications.